Aloha and thank you for joining us. We are coming into breaking news with the Governor, David Ige, beginning a press conference now.
Of how deadly this disease is and the way that COVID-19 continues to hurt our community. Nevertheless, things are getting better every day. The numbers continue to look very good. With only one new case announced today, we are confident that we have flattened the curve. Thank you for your hard work and diligence. You should be proud of your effort and your willingness to sacrifice for our community. As I've said before, by working together, we can make a difference and we can beat COVID-19. New cases are at an all-time low. Testing capacity is strong. Hospital capacity is very manageable. With me today is Dr. Bruce Anderson from the Department of Health, who will be providing additional insights into the case numbers and testing. With these kinds of numbers, we are looking at further easing restrictions and will continue our phased approach to reopening our local economy. Last week, the state and counties announced that some non-essential businesses could reopen. This included florists, certain real estate services, car dealerships, automated and mobile service providers, services provided on a one-on-one basis, and golf courses. Many of them have reopened, and thank you to those Hawaii residents who are again patronizing these businesses. Remember that these business activities must continue to follow social distancing, sanitation, and workplace safety guidelines outlined in my emergency proclamation. And keep in mind that if we experience a second wave of COVID-19 cases, some of the mandates may have to be reinstated. We also have more good news on the economic front. The U.S. Small Business Administration started taking applications for forgivable loans as part of the second round of the Payroll Protection Program, or PPP. You may recall that in the first round, Hawaii small businesses received more than $2 billion for approximately 11,500 companies and organizations. Applications for the second round of the PPP started a little over a week ago. And as of May 1st, more than 7,700 additional Hawaii small businesses were approved for more than $400 million in forgivable loans. This is a critical lifeline for those businesses, and we can thank Hawaii's congressional delegation and our financial community for these outstanding results. Another important part of our reopening of our community is the plans for our educational institutions. Last week, we heard about the Department of Education's plans for graduations. I want to take a moment to congratulate all of our graduating seniors. You have achieved an important milestone in your life, and I wish you well in your future plans. Many of you will choose to go on to college, and many of you have chosen, just like I did, the University of Hawaii for your undergraduate education. With the current situation due to COVID-19, you are probably wondering how UH will operate this fall. With me today is Dr. David Lasner, President of the University of Hawaii, who will be announcing the plans for the UH system. Again, thank you for your efforts in the fight against COVID-19. Remember to maintain your social distancing. This is our best weapon against COVID-19. Wash your hands, stay home if you're sick, wear your masks, and if you choose to go out and patronize any of the reopened businesses, please obey their social distancing requirements. You have achieved remarkable progress, so please continue your hard work. Please take care of yourself, take care of each other, and most importantly, help take care of our community. Thank you.
Thank you, Governor. Our next speaker is University of Hawaii President David Lasner.
Thank you, Governor, and like you, I'm a proud UH alum. Our faculty, our staff, our students have been completely amazing this semester. Upon their return from spring break, all of our classes went online with little preparation and notice. People's hearts have been in helping one another, faculty helping faculty, and students helping faculty, students helping students. It's been just amazing, and we're now preparing as we wind down the semester for a full class of students who will complete their semester, thousands of whom will graduate and move on to careers, to their homes, perhaps to graduate school as well. But as we start planning for fall, we realize this is not what we want our students to experience in the fall. So today we are announcing our plans to return to in-campus instruction at our 10 campuses across the islands for fall 2020. This will not be business as usual. We are not going back to the way it was in fall 2019 or even the beginning of spring 2020. Rather, we will be implementing in-person instruction in our classrooms, in our labs, perhaps even outdoors on our campuses, and it will be done in a safe, COVID-19 aware manner. We will implement social distancing measures in our classrooms, labs, offices, libraries, and study spaces. We will ensure that we have provisions for sanitization, hand washing with instructions for everyone. We will be making much greater use of online technologies. Many of the lessons that we learned this spring will be applied as we move forward. We will have a number of hybrid classes, particularly some of our large lectures. The lecture content will be moved online, and the interactive portion may be conducted in person in COVID-aware, safe manner. And we will be making sure all of our offices are safe for all of our employees as well. We will have in place measures for testing, contact tracing, quarantining as needed. We do expect to have our student residence halls open on our Manoa and Hilo campuses for those students who really need a safe place to live while they learn. While we are putting all of these practices in place to ensure a safe in-person fall 2020 semester, we are also acutely aware that we do not control the environment. And as the governor just said, there is a possibility that we will have a resurgence, another peak on one or more islands. And in that case, we will be prepared to revert to fully online instruction if necessary. We will use the lessons that we learned from this spring semester, and we will apply them so that we can do an even better job with the planning and preparation that moving online really require, with teams of faculty engaged over the summer based on surveys of students and faculty to tell us what they experienced this spring so that we can move forward in a high-quality mode if that becomes necessary. Right now, there is no better time for students to engage in higher education. Whether you are one of our many high school seniors graduating, and I also congratulate you, the opportunity to move into higher education to provide a better life for yourselves, your families, your communities. This is the time, and especially when unemployment will be facing so many of us in the community. It's also an opportunity for those who have lost their jobs, sadly, to consider whether returning to school and learning something new to get a new job. Now is the time for that also. Thank you.
And our final speaker is Health Department Director Bruce Anderson.
Aloha, everyone. I'm pleased to report we had only one report of a positive case on the Big Island, adult resident there. With this new case, there's a cumulative total of 621 positive test results since the end of February. Of these cases, a total of 548 individuals have been released from isolation. To date, there have been nearly over 33,000 laboratory tests conducted for Hawaii. Less than 2% of those tests have been positive, which is a good indicator that we're not missing a lot of cases out there. In states where you're seeing thousands of cases, their positive results are often up in the 20–30% range. Less than 2% is what many states are trying to achieve as a goal, and we're practically there already if you consider just the number of cases or tests we've done. The stay-at-home order, social distancing, use of masks, and other prevention activities have dramatically reduced the rates of illness here in Hawaii. My staff tells me that influenza-like illness has dropped to an all-time low in Hawaii, lower than Hawaii's historical baseline, and lower than the national influenza-like illness rates and the national baseline. So not only are these measures helping in reducing the threat of COVID-19, but also are helping with many of the other disease problems we have here in Hawaii and around the world. Our moving forward with opening up our state and returning to a new normal is going to depend on the ability we have to manage COVID-19 going forward. From a public health perspective, we need to be sure that our healthcare system's adequate to deal with the issue. As the governor pointed out, we're in good shape now. Approximately half the beds are being used, and I think we have sufficient surge capacity. But we also have to have sufficient resources to be able to do contact investigations and also to isolate and quarantine individuals as necessary. The identifying cases and their contacts and tracing those contacts is going to be a key to our success going forward. I'm pleased that we have a terrific staff and the Department of Health that's been very effective in dealing with this issue. And recently we've added another 30 or so volunteers to help with surge capacity. And we have options to increase even further if we need to. The National Guard and others are standing by ready to help if we need that help. As it relates to surveillance, we're going to be needing to expand that program as well. We have a very active influenza surveillance program, which we've expanded to include testing for COVID-19. We're now engaging the community health centers in outreach and in collecting samples, as well as other private providers. So we're going to be expanding that program. We have a port of entry screening going on. People who come here with respiratory illness are being screened. And we expect that we're going to be doing serological surveys and other surveys to try to better understand how COVID is being transmitted in our community as we go forward here. Actually, as an example of that, this week, the case we heard today was a case in Kona that was not associated with any of the, with a cluster associated with the McDonald's franchise there. In fact, that case is one of 3 clusters that are probably unassociated with that case in the Kona area. One was a family of 4 who were all infected. Another situation, a couple both got infected. And this case is yet another situation where there is evidence of some community transmission, emphasizing even more that we need a good surveillance program, and we have that. We're able to identify the cases, identify contacts, trace those contacts, and respond. So we're in pretty good shape as that goes. We still need to work on making sure we have PPE and other infrastructure in place. But with that, we can start talking about the opening of Hawaii and returning to the new normal. Thank you.
Thank you very much, Dr. Anderson. We'll move on to our questions now. Our first one is for Governor Ige. This is from Lauren Day, KHON2. Director Hara testified to lawmakers that the health department is pushing back against plans to increase rapid testing and contact tracing to help reopen tourism. Hara says there are personnel from the National Guard as well as nursing students who can be trained. Why is DOH pushing back?
I mean, I think it's a misunderstanding. It's not so much pushing back as acknowledgement that we do have the personnel that we need to handle the current case count. General has been very active in planning for the worst case scenario when we see hundreds of cases instead of the 1 or 2 or 10 that we're seeing now. So we continue to build the capacity. The Department of Health is working to identify those who can be trained and brought in to expand our ability to contact trace. I would want to make a comment specifically that I know that testing and contact tracing has been a huge problem in virtually every other state, from New York to Michigan to New Jersey. And I want the people of Hawaii to know that we've had capacity for testing here. Our lab was one of the first labs certified, and once the private labs came on board, we have adequate testing capacity here in the state so that we can test those who have symptoms or those that are close contacts of those positive cases here in the state. And that is so important to a broad-based and well-thought-out testing strategy and contact tracing that would allow us to bring back businesses in phases.
Okay, thank you very much. Dr. Anderson, did you want to respond to that? Okay, thank you very much, Governor. Next bunch of questions for you, Dr. Anderson. This is from Ashley Mizuo over at HPR. Is ICU capacity surging at hospitals in the state due to people who put off care to avoid taking up bed capacity for COVID-19 patients and now have far more serious injuries and ailments?
One of the reasons why we're wanting to look at the issue of capacity is to be sure that those who've put off elective surgeries and other surgeries will get the care they need. As people have, in some cases, put off attending to conditions, we are concerned that those will become worse, of course, and will require much more aggressive interventions. So it's important that people attend to those problems that have been problems in many cases for many years. Diabetes, for example, many heart conditions and others need attention. And although they may not need acute care or surgery, they need to be attended to. So we're looking for the day when people can freely go to the hospitals and be able to attend to their needs.
Dr. Anderson, another question for you. This is from Melissa Tanji, Maui News. Could we have more COVID-related deaths than we are aware of, since doctors can list cause of death as pneumonia, which could have come from COVID?
Well, there are lots of underlying causes of death among many of the COVID patients. Many of them are elderly and have conditions which would make them more susceptible to COVID-19, often chronic conditions. COVID-19 is a very aggressive virus. It is particularly difficult for a person who has chronic health conditions. Often people are actually dying of pneumonia and or other complications associated with pre-existing conditions. So certainly those are issues. However, in most cases today, if a physician expects or suspects that an individual is infected with COVID-19, they would be tested if they were in an acute care unit. And it's unlikely we expect to see a lot of deaths, in fact very few deaths, if any, associated with COVID-19 that were not identified as such. Physicians know what to look for here. It's a fairly unique illness which has a course of that is obvious to most physicians who are tracking the disease.
Thank you very much, Dr. Anderson. Our next question is for David Lasner, UH President. This is from Shivani Ramos from Kaleo, UH Manoa student paper. Will there be any quarantine protocols in place for mainland or international students when they come to the UH in the fall?
Absolutely. So our plan is to be in full compliance with whatever practices are required for the public health. We have already been in touch with state officials to understand those, and whether or not they are exactly the same as the 14-day requirements that are in place today for the mainland, for international, and for inter-island students. We'll make arrangements to ensure that anyone who arrives and needs a place to be quarantined, particularly our residence hall students, we will provide a place for them. and ensure that they can participate in their studies and be fed. And some of them may choose to come early. In other cases, we may make other arrangements, but we absolutely will comply with all public health requirements.
Another question for you. This is from Rickwan, KITV4. He's asking, what is the most difficult obstacle you face in bringing students back to campus?
I think the highest risk that we really face, I think, is associated with the residence halls. That was a call we made early on, that we wanted to keep residence halls available. We just have many students who have no safe place to go other than to stay with us. Could be a challenging home situation, could be an international student who has no place else to go, or if they leave, they may be going back to a less safe place or not be able to come back. So I think, you know, managing those risks and really coming to that decision that we want to be there for our students was probably the toughest thing we've had to face.
Another question for you, Dr. Lasner. This is from Lauren Day, KHON2. What are your plans to host athletic games? Will UH sports continue in the fall?
We're not there with a plan for intercollegiate athletics just yet. It's complicated for student athletes, it's complicated for fans, and most of all, it's not something that UH can unilaterally decide. We play in two different athletic conferences. We play in the Mountain West Conference for football. So our games and our schedules are set collaboratively with the conference. We play all of our other sports primarily in the Big West Conference. And similarly, the decisions that we make will have to be done collaboratively with them. I will tell you that our athletic director is in regular contact with his colleagues at our other member institutions and with the conferences to try and figure out what a new normal will look like this fall for athletics. And frankly, the entire NCAA is also engaged in conversations about what athletics can look like. But clearly, if a university is not in session, intercollegiate athletics will not be in session.
All right, another question for you. This is from Ashley Mizuo. How does freshman fall 2020 enrollment look like?
And that is a summary of what's going to happen at University of Hawaii in Manoa. Questions do continue. If you'd like to listen to the rest of the press conference, please go to our website at khon2.com or on our Facebook live feed. I'll recap what just happened there today. University of Hawaii is planning to resume in-person instruction at all of its 10 campuses statewide this fall, including residential living at Manoa and at Hilo. That's also similar to something we've just heard this afternoon from Hawaii Pacific University and Chaminade University. Both of those private universities also planning to resume in-person classes this fall in Hawaii. Now, there is a caveat on there. The UH president explained all of this will be done in a very COVID-aware, he used that phrase, COVID-aware manner. Expect to have a lot more social distancing, maybe even some classes outside, and no big close-knit settings for any classrooms in terms of any of those crowded classrooms like you could picture the old lecture halls. There also is no plan at this time for University of Hawaii sports. There's many complications on that, not the least of which is travel, but also the rules and regulations of the many different conferences that our colleges and universities participate in there. When mainland students or international students or inter-island students need to travel to their campuses as well, there will be precautions for that, whatever the rule is at the time this fall, whether it's still the 14 days for all of them, mainland, international, and inter-island, or whether there will be by that time different types of protocols is yet to be seen. But President Lasner said some solutions to that could be that students who still do need to quarantine after their travels could come a bit early, stay in those safe residences that will be set up in what he called a COVID-aware manner. Let's take a quick look at where the numbers are today before we sign off for you. Now here we have the total number today, one brand new case, for a total of 621 all-time. 548 of them have now been considered recovered. That means only 56 active cases of COVID, and they're all being contact traced in the state of Hawaii at this time. 17 deaths so far. But take a look at this. This is out of the 34,711 tests done as of today. Only 1.79% of them, of all time, have come out positive. Now, I've been doing some analysis on them, and if we look at just the past week alone, it's actually quite a rapid amount of tests being done, anywhere between 500 to 1,000 tests a day, and we've been getting 1, 2 positives here and there. That's a 0.1% positive rate of recent tests. We'll continue to break that down in more detail, but this is exactly the data that the governor and the health director are referring to when they say it looks like it's time to be able to safely tiptoe into reopening more parts of the economy and be ready to pull it back should it spike again. We'll have all of this coverage and more tonight on our newscast beginning at the KHON2 News at 4. Thank you so much for tuning in. Aloha.